Welcome to another edition of Your Health with MU Healthcare, and our guest today is Dr. Jeffrey Litt with University of Missouri. And if you would tell folks a little bit about yourself, what you do here, sir.
Sure. I am the main burn surgeon and the burn director, as well as the wound program director here at the university. I see a vast majority of the burns that come in, and we see most of the burns that occur in all of mid-Missouri. And if they need any operations or skin grafts, I'm typically the one doing those as well.
And we're kind of going to talk a little bit about something timely with burns, as 4th of July is coming up. What type of burns do you see come in associated with 4th of July injuries, and do you see quite a bit of them around that time frame?
So we do see a number of injuries, typically anywhere between 12 and 20 or so a year. Most of them do tend to be less requiring of major surgeries or skin grafting, but we have grafted a number of them over the number of years. And then we also see people who misuse various explosive materials and have typically really bad hand injuries. And when it comes to partial amputations or really badly broken hands, then we have our hand specialists come in and help us with those. And we see one or two of those a year as well.
What are some of the dangers involved with those burns that lead to amputations?
In the folks who have needed amputation, particularly of the hands or fingers, it's been the explosive nature of the various fireworks. Holding an explosive as they light it and the fuse just went quicker than they expected, or worse yet, picking one up that they thought was a dud and then having it explode on them.
Certainly, if somebody were to experience something like this, what's the key whenever they're getting to the emergency room and keeping that wound from getting real bad?
If it is a significant explosion type injury, then a 911 call right away. And 911 may even feel the need to do things like putting a tourniquet on if there seems to be major blood vessel damage or significant hemorrhaging. If it's a burn, quote, just a thermal kind of burn without the explosive nature, gently washing off with some cool but not ice cold water, and covering with either a clean dry dressing if you're going right over to the emergency room or the urgent center or your doctor's office, or if you think that it's something that can wait a day until the next day, then something like a triple antibiotic ointment or Neosporin and a non-adherent kind of dressing, which you can buy over the counter at various drugstores.
With these major burns that require skin grafts, what's the process through that? Does it require several surgeries?
It may. It depends on the nature of the injury. A lot of the time that we see these pure thermal kind of injuries, and we determine that they are in fact third degree don't tend to heal on their own and do require skin grafting for healing. We tend to take them to the operating room within a day or two of that recognition. We cut off all the dead stuff while the patient is under anesthesia, and if the wound bed looks like it's healthy and would support a skin graft, then we do the skin graft right away. Sometimes with these explosive injuries, there's deeper things involved, like exposed bone or tendon, and you can't put skin graft directly on that stuff, in which case we may have to do a series of surgeries to get the wound bed ready to accept a skin graft.
I was kind of hearing a little bit about this new technology, spray-on skin technology, for lack of better words. You could describe it to us a little bit better, sir?
Sure. So this idea has been around for a number of years and actually has been used overseas in various countries for a number of years as well. But it recently passed FDA approval for usage here in the United States off of a study protocol. And so what it basically does is it takes a very small piece of skin, as small as a postage stamp or several postage stamps, and basically is able to separate the healthy skin cells that can then continue to grow and proliferate from the underlying tissue and make a suspension out of them that you can then spray on a wound that is surgically prepared to be able to accept a skin graft. And so you can take a very small piece of skin and cover a large area by making it a spray instead of a direct kind of one-to-one skin transfer.
Does that seem to work out a little bit better than the skin transfer?
It's not that it works out better, but the idea of a smaller donor site, because there's no way really to do a skin graft in this current technology and age without creating a new wound. So this creates a smaller wound that tends to heal more reliably than someone who needs kind of that direct skin transfer, where you take a sheet of skin from one area and put it on another. That's a pretty large wound that you're creating to heal a wound, and overall, that's been what we've done for decades at this point. It works well, but could it be better? Yes, it could be.
Outstanding. Any advice that you want to give folks out there before the 4th of July about fireworks?
So please be safe. Please have a designated lighter, someone who's not drinking alcohol. Please have a safe perimeter around where the fireworks are being lit off, where kids are nowhere allowed. I always tell people, don't give kids sparklers, even though as a kid I played with sparklers, and we would throw them at each other and stuff. But those are some of the hottest fireworks that are actually available. They can get up to 1,500 to 2,000 degrees. That can create a 3rd degree, full thickness kind of burn in a millisecond. Have some water source nearby, and better yet, instead of lighting fireworks yourself, go to one of the professional shows. It's typically a better show, a lot more fireworks, and you get more bang for your buck because they tend to be free.
Dr. Jeffrey Litt, thank you for your time today, sir. We really appreciate it.
My pleasure. Thanks for having me.
Another segment of Your Health with MU Healthcare right here on AM 1340 KXEO.